Ready? Okay. Walter David Spence. I started getting severe back pains. I went to my primary care physician and talked to him about it. He instructed me to try some physical therapy. So we did that. I went to a physical therapist and we worked on that for a few months, and it wasn't getting any better. Nothing was happening for me. It wasn't getting any better. So he decided that I needed to go talk to a surgeon, Ortho Carolina. So I went there and continued with the physical therapy. But before I went, I had an MRI. Had to do an MRI, and they found out that it was my L5 disc was bulging and putting pressure on the sciatic nerve. I had pain not only in my lower back, but also in my hip and knee and foot. It was very severe. At times I couldn't even move. I just had to lay down because it hurt so bad. And that was about the only way that I could ease the pain, was just to lay down, let the pain ease up on me. So I went to Ortho Carolina, talked to them about it. They explained to me what was going on, and still don't know what caused it. I just all of a sudden started happening, and over a couple of days it just got worse. There was don't really know what caused the problem, other than just age. I'm 63 years old, so maybe that, I don't know. They gave me an epidural. That helped a little bit, eased it up some, and but it didn't by no means go away. It was still bad, and it would get worse. So I went back again, and they gave me another one. The second shot didn't seem to help any at all. Now I talked to the surgeon, and he recommended removing the disc, fusing the bones, insert an artificial disc and fusing the bones. He said I'd lose about 5% of my mobility. That scared me. I didn't feel like surgery was what I wanted to do. So I heard the commercials on the radio about Dr. Shapiro. So I came to see him, talk to him, and he told me what he does and how he works with the machines and helps to stretch and relieve the pressure in the disc and try to get it to go back to a normal shape to relieve the pressure off of the nerve. Well, I decided that was what I wanted to do because I was still scared of the surgery and I didn't want to go that route. So I decided to go along with what he suggested, and I was skeptical. I wasn't sure it would work. And as I continued to come, I started out coming 3 times a week and going through the procedure 3 times a week. And for a while, it felt good sometimes when I did it, sometimes it didn't. I didn't seem to be getting any kind of relief. And he told me when we first met, it might take 40 sessions, might take 80 sessions, he don't know, but he knows that it'll work. And sure enough, after about 55 to 60 sessions, I'm not sure which, it just relieved up. All the pain that I had in my the hip, the knee, and the foot was gone. I didn't have any of that. It was all gone. The back, I'm still a little sore there, but that was more of a muscle thing than it is from the sciatic nerve, the pressure from the L5 disc bulging. But, all of the pain from the sciatic nerve pain, all of that, in my hip and knee and foot went away. I don't have any of that anymore. I hadn't had it since that time was about 55 or 60. I'm not sure the count, but and since then it hasn't come back. It's been doing fine, and I was so glad to get rid of that pain. I hope it doesn't come back, because that was a terrible pain, and I don't wish it on anybody. But that's pretty much what happened.